Realmente esto es algo que cambió mi vida.
For me, it's made a profound impact because now I see the other side of that story.
You cannot save the world, like I said, but we can do it one patient at a time.
HELPS International provides enduring programs of practical, social, and spiritual value to the people in the developing world through a system of partnership and mutual responsibility. Since 1984, HELPS has been changing people's lives through an integrated approach to poverty reduction through education, economic development, healthcare, and products that transform homes in rural Latin America. HELPS works to provide greater opportunity for quality education, enables farmers to improve their crops and yields in order to put money in their family's pocket, transforms the homes through O'Neill products which radically improve a family's quality of life, and sends medical teams who bring hope to those with limited access to health care. Here are the stories of HELPS volunteers who changed lives and whose lives were changed.
Yo soy uno de los propietarios de Hotel Casa Santo Domingo y hemos tenido la gran oportunidad de trabajar en organizaciones con proyectos como el de la instalación de estufas con la organización HELPS, ya que tuve la oportunidad de trabajar en fuegos abiertos y sentir lo lindo que es el cambiar vidas en nuestro país. Creo que podemos ser un buen ejemplo de lo que significa ser un buen guatemalteco y empezar a involucrarnos toda la parte de la sociedad civil en los cambios internos que tenemos que hacer en nuestro país para que notemos la diferencia, para que esta gente tenga una nueva oportunidad de vida. HELPS ha demostrado a lo largo de todos estos años que son programas exitosos en nuestro país. Nosotros como guatemaltecos debemos de adoptar estos proyectos. Nosotros ya somos parte de este gran proyecto de HELPS y los invitamos a todos y cada uno de ustedes a que se unan, a que ya no solo veamos para atrás, critiquemos o veamos qué hicieron mal, qué hicieron bien nuestros gobiernos. Seamos parte de la solución a los grandes problemas que tenemos dentro de nuestro país. HELPS tiene la solución, lo ha demostrado y estamos trabajando muy duro para sacar adelante todos y cada uno de sus programas.
This is number 6 on the inside, and then we've done 5 outside, and we'll do one out here in just a minute. My name is Steve Farish, and I'm actually retired. This is the first out-of-country experience. My group actually purchased 2 of the stoves as part of my sponsorship to come out. It's been a true experience. Up hills, very small living spaces, lots of smoke. You can see where the need is truly here for what we're trying to do to accomplish for better health, obviously, especially for kids. We've run into lots of kids, you know, so it makes it really personable. But you can really see the appreciation from us being here. I think they realize how this is going to help. In my career as a police officer, we dealt with lots of immigrant issues. As a human being, I'm able to take care of another human in the way that they need to be taken care of. So when we come here, you actually get to see the other side of what I had to deal with on the police department from more than likely the brothers who are coming to America. This is a really delicate situation to be able to actually see this side. For those who are interested or thinking about that sponsorship of things and worrying about, you know, I don't know whether this is something politically correct I need to do. This is a human story. This is not a political story. So the more we can do from the heart and from the mind and the pocketbook, that's what's going to make the biggest difference. The more stoves we can put in, the better off they're going to be, and that's our goal for here. All the doctors coming for the clinics and for the surgeries and things. That's a wonderful thing to leave the hospital in the morning knowing they're doing surgeries all day long. When we get back, they're still doing surgeries, and we've put in 3 teams this week, and we put in 15 stoves already. We got another day to go. So it all comes together for you if you know both sides of the story, and for me it's made a profound impact because now I see the other side of that story.
Francisco is a blind man who was found by one of the help staff on a bus. He was lost. He brought him here. They even needed money. They didn't want to come because they couldn't even afford the bus ride. He came with his wife. He's been blind for in one eye he lost complete vision about 3 years ago. The other one has been longer. And he felt he was useless to society, to his family, to his friends. He was embarrassed. And he had no vision in one eye. We measured it, and it's barely light perception, and the other eye he had a light perception vision. It's a little difficult on those patients because if you do surgery on the eye that they see a little bit and they lose some of that vision, they don't trust to do the other one. But on the other hand, if you do the completely blind eye and then they don't improve at all, they don't trust you to do the one that sees a little bit. So it's a little bit of a catch-22. On the third day, we removed the patch on now both eyes, and for a while he was trying to, I think, grasp what had just happened to him, though. ¿Puede ver mi mano? Sí. ¿Cuántos dedos ve?
5 dedos. Muy bien.
He couldn't see
no podía ver
nothing. And in that morning, the series of events that happened were amazing, from first being speechless to then just crying that he was overwhelmed with the happiness that he now could see. He started telling us his story of what it meant for him, that he was going to be able to provide help with, he's going to be able to feed his family, he was going to be able to give money to his wife. As he told us that he almost died a few times, that he said that sometimes he wished he had died. In the next couple of hours, he went from being this person who wouldn't talk to anybody to, wow. Now he was walking. A little later, he actually was running from one side to the other, saying, look, I can run without falling. And then later that morning, he said, when are you going home? And he said, oh, I don't want to go home quite yet. I'm quite happy here. So he just stayed, hung around, and he started talking to everyone, everybody, anybody who would be willing to listen to his story, and everybody was pretty much happy to hear it. And then on his way out, he's leaving the clinic. There's this other man, Ephraim. Same problem, he had white cataracts in both eyes. He was going to have surgery the next day. Francisco told Ephraim his story. We have a nice picture that is amazing, and this is Francisco leaving the clinic with the sunshine, so he can now see, and Ephraim in the dark inside the clinic waiting for his surgeries to happen. Definitely highlight of the trip. So a little donation, a big donation, all donations help, because you cannot save the world, but we can do it one patient at a time. And I think doing that, one donor at a time, the economies of scale are huge.
Francisco's journey from darkness to light has transformed his life and created a ripple effect in his family and community. The economies of scale are extensive, and we invite you to support helps in order for deserving people like Francisco to experience dawning transformations, and through hope and dedication, keep the light shining ever brighter in their lives as well as our own. Helps. Changing lives.